Hey everyone, I thought I'd join in the debate that seems to be raging out there, more on the social media, I guess, about hands-on treatment or manual therapy, whatever you want to call it, versus exercise for treating and managing people who are in pain or have sustained physical injury. It's an interesting debate, but what I'm seeing in clinical practice is a lot of patients who have actually been off to see somebody and they've just been given an exercise sheet or they've been given some generic exercises to do. And they've been very disappointed. And I'm not going to name professions or anything like that. I guess I can talk about my own profession. I'm a physiotherapist. I've been practicing for 25 years. I guess I'm old school and old fashioned, and I went through the era where manual therapy was taught at university, probably not very well. And I guess I was privileged when I started working in private practice to work for what they used to call manipulative physiotherapist, and now called a musculoskeletal physiotherapist, who had a very large reputation for manual therapy skills. He was very good at what he did, which was tough for me when I was young. I had to learn very quickly. So I guess what snuck up on me, and I've noticed, is there are so many clinicians who have poorly developed manual therapy skills. It's not really their fault. If it's not been taught well in their undergraduate training and they're not receiving mentoring out there in the real world, it's very, very hard for them to develop those skills. My opinion, and this is just my opinion, is that you can be a wonderful teacher of exercise. The reality is people don't do the exercises anyway, unless we make them do it. But the other thing is YouTube and these social media platforms have lots of experts evaluating and prescribing specific and graded exercise. So if that's all you do, you're up against the internet. You're up against social media. So my clinical experience tells me this, and this is based on some good evidence too, that manual therapy still has a powerful role to play. You help people move, you reduce pain, you reduce spasm, you become a physical enabler of normalised movement. That helps reduce pain and it helps improve function. If you want to implement specific exercise, it's very, very important. Your hands, your manual therapy skills will buy you trust. If you can use your hands, you can guide movement, you can facilitate movement, reduce pain, reduce spasm, reduce joint stiffness, even help people regain balance, you get their trust. So when you go to the next step and you start adding specific and very important graded and progressive exercise as part of their treatment, these patients will listen to you. But if you just dive straight in, throw them some exercises, that's not what they're expecting. Okay, an expectation of your patient is a very important thing to understand. Yes, you can set expectations when you onboard a client, but just remember, if you're a budding physiotherapist and you want to build trust, you first of all need to listen to people. You need to find out what they want as well as what they need. And if you think that you can manage people purely hands-off, good luck to you. There are some great courses out there. Learning manual therapy skills is very important. And I just don't think this profession can afford to go off the rails and forget some of the reasons why people come to see us. So it's okay to use your hands as long as you develop the skills to do so. Thank you.